Hello, everyone. It's a little later in the day than my typical live. I had some scattered meetings, so didn't have quite the time I wanted to dedicate with you. I will be going live on Instagram later at 5 p.m. Pacific with Gianna Simone. If you're not familiar with her, she's an amazing actress. Really excited about that. So stay tuned on Instagram. Today I wanted to speak to you about one of my favorite patients to work with is someone who's dealing with, in particular, type 2 diabetes. I do have individuals who have type 1 diabetes and they do very well too. But I do get this question about, can someone eat a plant-based diet who has diabetes? And that's an important question to ask because, in the typical medical dogma, for example, what you'll see is avoid carbs, right? Carb counting. Let's stop, carbohydrates because those cause blood sugars to rise. Well, and that makes sense. And at a higher level, you might think that might be the answers to avoid carbohydrates or lower them. But we're forgetting the root cause of what causes insulin resistance. So I'm going to focus on, in particular, type 2 diabetes and discussing insulin resistance and why a whole food plant-based diet, not just a processed plant-based diet, but a whole food plant-based diet is so helpful for type 2 diabetes. However, even with type 1 diabetes, you can get insulin resistance, which makes you utilize more insulin than would be necessary. So again, across the spectrum of diabetes, numbers can improve and medications can be reduced if you focus in on a whole food plant-based diet. And why is that? Well, first of all, let's look at the traditional medical prescription, right? You'll see someone provide medications, let's say someone's A1C, which is a hemoglobin A1C, which tells me the stickiness of the red blood cells over the course of the last 90 to 120 days. And the reason we use that measure is because it's a pretty good indicator of the day-to-day over a longer course of time, how high someone's blood sugars are relatively at most of the day. So if you have someone who's less than 5.7, this is considered normal. I would say even though if you're hitting 5.5, 5.6 on a regular basis, you might be heading in the wrong direction. We want to maybe pull that back down to maybe 5.4 and lower just to be in the more normal range. Just like it'd be like looking at BMI, you want to be kind of probably in that lower range, under 23 of your BMI, depending, of course, on the individual person. They might have a lot of muscle mass, and BMI is not the greatest measure, but just using this as a general comparison. Anyway, so when you are between 5.7 and 6.4, this is considered pre-diabetes. But in my mind, you might as well consider yourself with diabetes because the train has left the station. And that means that we are headed barreling down the type 2 diabetes diagnosis, and it's just arbitrary. It really doesn't matter because all of the things that cause type 2 diabetes are already in play. And the severity may not be there yet, but it's coming. So prediabetes is a wonderful place to make lifestyle changes, and especially including a whole food plant-based diet, because we can reverse that much easier than someone who has had type 2 diabetes for a decade or longer. So there's what I'm looking at. So I run a glucose mastermind, which I just opened yesterday, registration for. I only keep it open for a short period of time. I take very limited, small number of people. If you're interested, you can check it out at drmarbas.com, click glucose mastermind. That one starts in middle March. Again, limited seats because it's very interactive. We meet twice a month for 90 minutes. And I order you a CGM anywhere in the country if you live in the United States. Lots of cool stuff happening there. Anyway, but when you look at why a whole food plant-based diet works, what actually happens when I put someone on a CGM, so now I'm measuring their blood sugar 24/7, right? We put them on a whole food plant-based diet. What are they actually going to see? So I'll tell you a typical patient. So I think it depends on what type of whole food plant-based diet we do. So you can do a very higher glycemic index foods, for example, white potatoes, rice, things like that. These things break down very quickly. In and of themselves, those are foods that can be very nourishing. But in the context of insulin resistance, you will see blood sugars rise because you're insulin resistant. Does that mean that these foods can't be incorporated into a healthy diet? Absolutely not. But if we're wanting to mitigate high blood sugars, especially in the beginning, as we're dealing with someone with insulin resistance and type 2 diabetes, we might want to stick to lower glycemic foods. And these are foods that won't cause the blood sugar to rise as quickly. Non-starchy vegetables, particular different whole grains like quinoa, buckwheat, um, beans, lentils, again, certain lower glycemic fruits like berries. I have a whole list. I go through this whole thing in my Glucose Mastermind. I also have an insulin resistance course. If you want to, there's a whole ebook and workshop there if you want to see that. Tons of resources here on my website. But that is the difference there. So I will help people move to a whole food plant-based diet, and we move to a lower glycemic index foods just so we can see lower blood sugars, get off medications a little bit faster than if we were to continue eating these higher glycemic foods. And how quickly do we see things change? Well, I have had patients, I had a patient when I first learned how strong, how amazing this diet is. I stopped 60 units in 3 days of insulin. That blew my mind. So typically when I start someone on a whole food plant-based diet, if they have type 2 diabetes with insulin as one of their medications, I will typically cut it in half or lower it by a third to a half, depending on the person, how long they've had the diabetes, how much insulin they're actually taking, what are the other medications. But that's a rough estimate of what I'll start with, because the last thing I want is someone to actually become hypoglycemic, or meaning low blood sugars, because now we're over medicating them. And I can always add back more medications, but it's really hard to detract insulin when it's already in the system and causing low blood sugars. You're chasing it with food. So that's a really important point to understand. This is more of an art than a science. This is just what I have found over the last 12 years working with a plant-based diet with people with type 2 diabetes. That seems to be a safe place. When I look at blood sugars on the CGM or a fasting morning blood sugar, what you'll see is it hits around 150. That's when I really start pumping down the medication. Because if you're consistently under 150, we can start safely decreasing medications pretty well. And again, it really depends on the person, how long they've had the insulin resistance. Do they have they have they burned out half their pancreas or more? So again, really varies. I don't even see that they need a significant amount of weight loss. The body does some amazing things, even with, you might see a shift of 10, 15, 20 pounds, and that's quite a remarkable change. And that is really cool. You also see a decrease in inflammation when people consume a whole food plant-based diet, which is a big driver of insulin resistance as well. So taking all this into consideration, what is actually happening on a cellular level? Well, when someone eats a standard American diet, we eat high amounts of saturated fats, high inflammatory foods, and these ultra-processed foods, animal products, things like that. What's happening is you're getting the body actually storing fat in places outside of the subcutaneous fat, where the fat needs to be under the skin and stored, where it's supposed to be stored for days of famine, which never come, but that's another story. But now we start getting visceral fat storage and ectopic fat storage. So it means in the liver and the muscles and around your internal organs. This is very inflammatory fat. It's not meant to be stored there. And that is a driver as well of this insulin resistance. So now what's happening is on the cellular level, the cells are not actually utilizing the insulin very well. So imagine having a key with, I don't know, I always think of lard. You remember that Crisco? I don't even know if they still make that stuff. But my mother used to keep, and my grandmother used to keep bacon fat and grease in a jar, and they'd store it under the cabinet and use that to fry more bacon and fry other things. The thought of it it makes my little heart cringe right now. But anyway, so that is what I think of. So if you can imagine a cell with that kind of stuff, saturated fats, really mess up the ability of the cell to utilize the insulin as the key to open the door and let the blood sugar in. That's a very simplified explanation of what's actually occurring. There's multiple things going on inside the cell, the insulin receptors, lots of things going on. And so that would be how insulin resistance gets started. It's inflammation, it's fat storage, it's lots of things involved there. But when you eat a whole food plant-based diet, we're decreasing saturated fats. We're seeing the body being able to return to homeostasis and heal itself. You see it clearing out these fats, the visceral fat. You see it clearing out the liver from the fat from the liver and the muscles, and they become more insulin sensitive, meaning now they can utilize the insulin that they're actually producing. And suddenly blood sugars drop dramatically. You don't need as much medication. Now, does that mean that every single person with type 2 diabetes is going to be able to completely reverse it? No. But what this does mean that you will improve, one, your clinical status. You'll probably definitely see a decrease in blood sugars, and a reduction of medications will be needed. Will you be able to come off the medications? I would say most get off most of the medications, and definitely a lot get off all medications. But it requires consistency in the diet on a regular basis. It doesn't mean, oh, I eat this way 5 days a week and go binge on the weekends and go out and work, or, go out and eat fried vegan junk food or alcohol and things like that. This is going to require consistency. You have a disease, it's just like taking a medication. Your food is your medication. And so, what should you be eating? Fruits, vegetables, beans, whole grains, nuts, and seeds. Should we be afraid of nuts and seeds? No. The reason I say this is because, like I said, I have seen data on thousands of patients, hundreds and hundreds of patients I've seen on CGMs. I've looked at their records. I've looked at their food logs. I've talked to them. And what you'll see consistently when they eat nuts and seeds, that does not cause insulin resistance. The only time I've seen it cause an issue is when someone is overweight and they're over consuming nuts and seeds to the point that they gain more weight, right? So that is the issue. But many times with the more nuts and seeds, they're also eating other processed foods. So take it for what it is. But as far as a direct causal relationship, I have not seen that with whole nuts and seeds taking. I utilize whole nuts and seeds to help people sustain energy. It helps people improve their satiety. It's good, healthy fats. These are healthy for the brain. They're healthy for your heart. So don't be fat phobic, please. Does this mean that I want you to go all out and just eat all that you want? No. So typically what I say is a quarter cup, which is a handful of nuts and seeds on a particular day for my women. For men, maybe they can go up to half a cup. So maybe 2 handfuls. I guess it depends on how big your hands are. So what nuts and seeds invariably would I get requests? That's the next question. I like hemp seeds. I like ground flax. I like chia and walnuts. Again, whatever your preference is, almonds are great source of calcium. You can change it around, do whatever you like. But the main thing I want to point here is there's lots of different ways to structure your whole food plant-based diet. But in the beginning, if you have insulin resistance or type 2 diabetes or your type 1 diabetes with some suggestion of insulin resistance, meaning that you're utilizing more than 25 to 50 units of insulin daily as a person with type 1 diabetes, we might want to look at and see if you have insulin resistance. There are labs that you can do to check your insulin resistance. I go through this whole thing in my course, and we'll certainly talk about it in the Glucose Mastermind. But what would those be? You could check your HOMA, the HOMA-IR, right? And so what you need is a fasting glucose and your fasting insulin. There is a calculation, and you can see what your numbers are. It's very simple to do. Quest will do this. LabCorp, you can ask your doctor to order them for you. But any of those would be very helpful. That will give you an indication whether you are insulin resistant or not. And then maybe a starting point to remeasure in a month, 2 months, or 3 months. So again, yes, a whole food plant-based diet is actually optimal for type 2 diabetes. When someone says you shouldn't be consuming carbohydrates if you have diabetes, they're missing the whole mark. They're missing the point. They're not seeing how we reverse the actual root cause. How do we, put out the fire, so to speak? And all they're looking at is, I like to use the analogy as if you have a campfire, right? And so you have the fire. This is what I would say the root cause is. And then you have the smoke. This is the evidence that the fire is burning, is smoke. So that would be your glucose readings. Okay. So you have the root issue here is type 2 diabetes, insulin resistance. You have smoke saying it's billowing and it's darker and larger, right? So the more the fire, the more the smoke, the higher your blood sugar numbers. So instead of giving you medications to try to put out the smoke or waft the smoke away, why don't we put out the fire? Seems like a reasonable thing for me. So that's what we're doing with the whole food plant-based diet. We're actually putting out the fire instead of wafting the smoke. I hope that makes sense. But yes. So again, definitely if you guys will check out my Glucose Mastermind. I only open this up every few months. And yeah, so it's been amazing so far. We've had people lose 20, 30, 40 pounds. We've seen blood sugars drop 200 and 300 points in a matter of, I'm not making this stuff up, 1 to 2 months of doing the Glucose Mastermind, utilizing the information, I give them an ebook. I'm working on the course for the Glucose Mastermind, but they'll have access to the insulin resistance course and meeting in small groups and looking at your data, getting your CGM, and just really understanding what that means for you as an individual. And yeah, it's been amazing. I love it. And so check that out again if you're interested. You don't have to be in the United States. I'm happy to have other people. I just can't prescribe a CGM if you live outside the United States, but maybe you can ask your doctor, or maybe you can get it some other way if you're outside the US. So hope that was helpful. And I've had some requests for what is in my daily smoothie. I was going to share with you here. Every single morning for, I don't know, good grief, 5 or 6 years, maybe not that long, definitely 5 years, 4 or 5 years, we've had this smoothie every single morning. So I make it in my Vitamix, which I've had for like 12 years. And I split it with my husband. Sometimes one of my kiddos is here and they'll take what's left of it. So basically it's a 64-ounce canister. I take mixed baby greens or the power greens or something like that. I'll take a couple of handfuls and I probably stuff it, try to get at least a third punch down. I'm literally punching this grass down, pushing it down nice and compact. Those are my greens. That's my base. Next, I throw in, don't laugh at me, guys. I throw in broccoli slaw. It has some carrots in it as well, but it's mostly broccoli. Broccoli slaw, handful. Push. Handful of cabbage slaw. Yes, push. And then I take cauliflower rice or just cauliflower, but I found the cauliflower rice gets down in there. I get more of it. So then I punch that down in there. Then I take a scoop of Garden of Life raw meal replacement. It's a chocolate flavor. It's delicious. You don't have to do that. I just found that it tastes delicious and it's another way to kind of get some extra protein especially if you're traveling and do some other things. We feel amazing doing it. It works well. Then I throw in, so now we're at probably 3/4 full. And so there's not a whole lot of room left. So now I've got, sometimes I put in amla, sometimes I put in ground flax if I remember, because it's in my fridge. Try to remember most days. But then I put in frozen dark sweet cherries, maybe, I don't know, 1/4 cup, 1/2 cup, 1/3 cup, somewhere in there. It's enough to cover like half of it. And then I'll put in frozen pineapple to cover the other half, right? So now I've got a layer of frozen fruit. Then comes the creme de la creme. It's the frozen wild blueberries, the Wymans. There's these little sweet little barista deliciousness. So good. Anyway, so I poured those on top and I mean, it's over the top, right? Then I use soy milk, unsweetened soy milk. That is my liquid. I fill her up. Some days I get a little too wild on my soy milk and it spills over, but most days I do pretty good. Then I put the lid on. I blend it for like, I don't know, 45, 60 seconds till it's nice and smooth and creamy. I pour it into 3 mason jars. 1 mason jar is full. Second mason jar is full. Third mason jar is like 3/4 full. I drink one, husband drinks one, someone will drink one later in the day, either myself or one of the other humans that walk around in this house. So that is my smoothie recipe for you guys. I will be 54 this year. I feel amazing. I'm so blessed to be able to share this message with so many amazing people. And I hope you found that helpful. But yeah, so yes, you can reverse diabetes on a whole food plant-based diet. I've seen, I don't know, I've been a doctor for over 20 years now. Medications are a band-aid and they don't stop the process. So you will require more medications, that I can guarantee, unless you change your lifestyle. And that needs to include a plant-based diet, moving your body, managing stress, um, really connecting with the being. I had this interesting thought. So I'm sorry this keeps going, but I really want to share this. The other day I was doing one of my mindful walks and I was thinking, wow, we're human beings. Where did human being come from? There's human, but we could just say we're humans. I know we're Homo sapiens, but I'm just saying the human being piece. There's dogs, there's cats, there's rhinoceros, there's a giraffe, there's apes, there's chimpanzee. They don't have chimpanzee being or dog being or cat being. We have human being. So I think the human piece refers to the man components, right? Man, woman, genderless response. But then we put the being, it's the essence, it's the spiritual dynamic of who we are. It's the life force that allows us to walk around and connect to each other, that energy that you feel. So anyway, I think stress and mindfulness is a big piece of that, is connecting with whatever you want to call that deeper spiritual piece of you. And it's a game changer. It's a game changer. So anyway, that's my favorite thing to talk about, but I'll talk about more about plants as you guys like. So thank you guys for being here. As always, I'm just so humbled and honored that someone would just watch. This is amazing. I'm always sending you, as always, gifts for spending time with me is love, peace, and joy and abundance in your life. And I just hope you have a wonderful rest of your day and your week. So thank you for being here. And I hope that was helpful. And I will see you next time. And take care, guys. Bye.